could you see that possibly a negative side effect of it would be like unnecessary care sometimes? Or do you feel like it would be more like, because we're responsible for like referring, that we'd be okay identifying like what's an actual problem and what isn't?
I actually think in the integrated model, it might be reversed, because I have seen, and I've read articles and papers about this, where physicians or medical, I'll just say medical providers, because that sort of covers the spectrum. Medical providers that are seeing a patient for the first time sometimes overdo because of the issue of like malpractice, like fear of malpractice. I can't remember the study that I just looked at, but like 91%, there was a survey done of a whole bunch of physicians, and 91% said that yes, they have ordered an image because they're concerned about patient satisfaction, or they're concerned about malpractice, or they overdo because of those reasons, not because they don't want to follow guidelines. So I actually think in a model where you have multiple different providers that can actually confirm or deny the need for different tests and measures, or services, treatments, whatever. If you have a group of individuals that are coming together to make that decision, or to help assist make that decision, you might actually see that utilization of those things goes down. That's the hope. But I also think it really just depends on the providers that are in the team, and what their individual perspectives and training might be.
Right.
So once again, I'm biased, and in a perfect world, I would see that integrated model as a way to reduce healthcare utilization, improve wellness, improve outcomes. And like for that patient that, probably needs to lose weight or stop smoking or whatever, and they are just not interested, they're in that, maybe having a behavioral health provider is a really good person to have on that team, because if they're in that pre-contemplation phase, they're not, that ultimately becomes the patient is a part of the team. So, you can have the behavioral health therapist provide some strategies that other healthcare providers can use to promote motivational interviewing. So I don't know. I just think that we have so much to learn from each other, and that in a team-based setting, ultimately those things would all be better, I would hope.
Yeah. And I think for the most part, it would definitely certainly be a benefit, because I think a lot of people would be like, oh, I didn't know like you guys provide this option. I can go and talk to somebody who would be, they're right there and them. So that would be great. And it makes it easy, because I think when you start like referring out to other people forget about it, or they have life things going on. So if it's like, oh, it's like, let's do this right now, they're like, oh, okay, let's do it, and I think it's very beneficial.
Yeah, I think that the one barrier to that, or the one exception to that, is, again, we are still functioning on a fee-for-service model. If a therapist or a provider, even in these team-based primary care settings, which are very few and far between in the private sector, but there are some that exist. If the therapist is there and they only are seeing 1, 2, 3 patients a day in that setting, they can't justify their salary doing that. So there has to be some sort of balance between the utilization of all of these services. And I think that is probably the hardest part, figuring out the logistics in the background to make sure that it's optimized from all angles, that the providers are seeing enough patients to justify their salary or their, compensation, and that the patient is receiving adequate services, and that they're accessible, and affordable and available. It is, like I said, it's going to take me my entire career. It's going to take dozens, maybe hundreds and thousands of other people their entire career to try to figure out a better way to do this.